Thank you so much for that. Next we have Julia Sheehan. And Julia works at the Hepatitis C Trust, where she's the manager of the National Women's Criminal Justice. Julia has more than 10 years' experience of working with people at risk of viral hepatitis, and she's passionate about the rights of and equality for women affected by the criminal justice system. Julia joined the Hep C Trust in 2018, and today's, I've already said that bit, so we'll just hand over now.
Thank you, Liz. Thank you. Can't see with my glasses on. Is that better? Oh, it's the same. Okay. That's my disclosure. This is a bit of an outline of what I'm going to be talking about. So I'm going to start with peers, people with lived experience. So I think what I want to do is talk a little bit about my own experience as someone who has lived experience of having hepatitis C, also self-clearing hepatitis B. I was classed as a high-risk drug user for many years, and I got diagnosed with hepatitis C in 2007. I also have lived experience of prison, and my first prison sentence was 1997, and my last one was 2015. And the only time I ever remember being tested was 2015. So it's amazing that we've come on so far. Sadly, at that time, it was venous draws of blood, and I was, as an ex-IV drug user, I was really difficult to bleed, so I left prison untreated. My pathway kind of treatment stopped there. I became abstinent from using drugs in 2015 and have remained so. It's something that works for me. And in 2017, I did DAA treatments and was cured of my hepatitis C. As someone who lived through the old treatments of interferon, I didn't do it myself. I was too scared. But I saw my peers who really suffered through that treatment, and I was never offered it because it had many barriers. And one of them was if you were still using drugs, you weren't really a candidate for it. So I was never offered it. So when I did the DAA treatment, and it was so simple, just the simple tablets, it blew my mind, and it really did change the course of my life. You know, I'm not academic. I stand here as a person with lived experience. And I got this passion in my belly that I wanted to spread the word, and I knew people were still scared about, you know, the horror stories of interferon and their questions, is it a little bit the same? And I really wanted to do a bit of work in that field. So I approached the Hepatitis C Trust, which is the organisation that I now work for, and I asked them if I could volunteer. And that was really the start of my journey into a professional life and this arena. Forever grateful for the Hepatitis C Trust. So I went anywhere that would listen to me and shared my story, detoxes, hostels. I just wanted to encourage people to have a test because I had no idea I had Hep C. Like, I was living with Hep C, and I don't know for how long prior to 2007. So I just really wanted to encourage people to have a test and tell them that the treatment was really so simple. So that's a little bit of a background. And I guess I think the reason I'm saying that is I wanted to highlight the journey from a person that had lived that life, then started volunteering, then upskilled, and got into paid work and became a professional. So that's our ethos, and that's really our ethos at the Trust. So I wanted to, thank you. So we at the Trust have people with lived experience who are in paid roles. We also have a whole army of peer volunteers that do what I did, and I think it's important to differentiate, and you'll understand why when I get a bit further down the line. So what do peers offer? We offer identification. We address and reduce stigma and encourage the hardest to engage to take a test, and we will support them through their treatment. We offer group workshops, one-to-one support including treatment support, testing. So we test, we have peer volunteers that test, and we CEFID for RNA results. We also offer staff training. This is what we deliver across the whole organisation, but I am going to move on to, this slide. This is a quick move on slide. Don't know whether I'm allowed to show it, that's why, but I just wanted to really highlight how much evidence there is out there that peer support works. So now I'm going to move on to our prison work that we do. So that's the work that I do. So in 2018, we rolled out our community peer program into women's prisons, and I was really part of that, and I was so grateful that I got to go back in and support women that were just like me, that had had the same experience as me. And, you know, I'd lived in prison where I was too scared to tell people that I had Hep C because of the stigma attached to it. So the fact that I could go back in and help to reduce that stigma and support women was really important to me. So what do we do in prisons? So partnerships are so important, and we have great partnerships that have took a long time to build, but with prison staff, with the healthcare staff, with the substance misuse teams, or actually I don't like that word misuse, substance use teams, and mental health teams. Some of the activities that we do, we offer staff training to any staff, be that nurses, the nursing team, the prison officer team. It's just really important that everyone is offered the opportunity for training. That helps reduce stigma as well and increases support. We offer support clinics, so they could be one-to-one support clinics. We sit in clinics and see patients that are positive, and we will support them through their treatment. And we deliver HITs. They are high-intensity test and treat events. You could ask a different member of my team who delivered the first hit. I'm going to say it was the women's prison team, because I think it was. We delivered our first hit in February 2020, and we, alongside the prison, it was Her Majesty's Prison Service back then, alongside the hospitals that treated and alongside the healthcare team, we went out onto the wings, or sometimes door to door if it was in lockdown, and offered testing to every single person in that prison. And more often than not, we got like 95% and upwards of that prison tested, and anyone that needed treatment was fast-tracked onto treatment. We also do wing-based outreach, which is really important, where we'll go out on the wings when people are on association. We'll talk, we'll have conversations, we'll give literature, and just spread information sharing. So these are some of our outcomes from 2019 to 2025. So we currently deliver our prison peer programme in 120 prisons in England. We've delivered educational workshops to 7,159 staff. 19,315 prisoners have attended our bloodborne virus harm reduction workshops, where we deliver education around hepatitis C, HIV and hepatitis B. We've had 224,682 engagements with outreach. We've delivered 82 high-intensity test and treat events, testing 54,080 with a 92% uptake rate. We've supported 6,947 people in prison on treatment. 3,343 people in prison have received Follow Me Through the Gate support into the community. So we have a Follow Me programme where we have a huge community team across the whole of England, in Scotland and parts of Wales, and we will fill out a form where we capture all information. It's their consent. We'll find out if they're homeless, which more often than not they are. We'll find out maybe where their tent is, where they're sleeping, if it's in a car, what the road is, maybe if they're begging for money, or what cash point or supermarket they sit outside. And our community team are excellent at outreach. They have like insider information because they've been part of that community, and they will find people that have been released and support them. We have 140 active peer volunteers that have contributed 29,155 hours of service and support. Testing events. So I've spoken a little bit about the high intensity test and treat events. They cost money, like big money too, because we incentivise as well on those. So what we are starting to do now is really utilise what prisons do, like what events they put on, be it a health and wellbeing event where lots of different outside organisations come in to raise awareness. We will hold a stall and we will offer testing. They're a way to reach. We used to do them and give out lots of information. We thought, why don't we offer testing as well? And to be fair, the high intensity test and treats have really allowed us to be able to do this work, because it's almost like we evidence our capabilities. So the prisons are like reaching out to us and saying, will you test at our event? That's incredible. So the key magic ingredients. We need national funding from the Department of Health, which we're lucky to get. You really need buy-in from criminal justice. You need trained staff. You need to have peers with access to the prisons. This is people with lived experience. This was not an easy feat. Yeah, it was definitely a challenge, and this did not happen overnight. It took, I think we had to show that we were trustworthy, and that's taken like a long time. I'll talk about me personally, I have to have a different kind of clearance as a person with lived experience of prison. So I'm effectively risk assessed, and the governor will give me access to that prison for 12 months, and then it gets re-evaluated. And I cover 12 prisons, so it's quite a bit of work in itself. I mean, it's a great thing because it allows mutual aid groups to go back in. It's not ideal if you're covering multiple sites, and I think that we're quite unique in that we do that. Our teams cover a lot of prisons. Some of them cover like 26 prisons. Peer volunteers, they're at the heart of everything that we do. They're incredible, and they, we have lived experience, so that it really gives us a connection to people in prison. It's I don't know, it is like a magic ingredient, most definitely. But people in prison who are living in prison have even more of an impact on their peers. So really important. Collaboration and partnerships. We couldn't do the work that we did without that. And peers at every table, from strategic to operational delivery. This is a little, so I don't have anything to put, so this just is a kind of an impact slide, and what we could be doing. So I don't know whether I don't have a pointer, but we do a very little part of it, basically liver, but we could be doing so much more, and that's kind of the direction that we really want to go in. Look, it's not even the fact that I've had Hep C that gives me that connection and that allows people in prison to trust me. More so, it's the fact that I've lived in prison at some point. That's like the game changer. So I think we were really eager. So the UK is a high-income country, and we wanted to present something that could be used in a country that might not be high income, that might not have as much money as we've had. And so some people's toes may curl when I talk about this. So this was a pilot project that happened in H&P Birmingham, which is a male prison in the Midlands of the UK. It holds 450 inmates, but it has roughly around 900 at this time it did. So an established group of volunteers known as the Expectation Team, who were already embedded in the prison reception process, were identified and asked if they would like to support hepatitis C testing through the reception process. This group was trained initially to provide harm reduction, and then they moved on to delivering Hep C antibody testing. Training was provided by us and by the prison healthcare. So this is people in prison testing people in prison. That's really powerful. So 3,906 people were tested between January and December 2023. Testing increased from 10% to 67% in the first month of the peer-delivered model in December 22. Rates continue to increase, with more than 90% of new arrivals tested from July to December 2023. Where the POC tests identified antibodies, patients were then supported to access RNA testing from a nurse. 8 to 10 people each month are diagnosed with hepatitis C, and 80 prisoners have started treatment since the introduction of this pilot. There is now a senior peer giving out antibody results. I think this is really powerful because, my presentation is Trust Test Street, and these men were trusted prisoners, and I think if you give someone a responsibility, during this period, we had no breaches of confidentiality, and I think if you give a responsibility to someone, more often than not, always in this case, that person could be trusted to hold that information. Oh, I want to go back a bit, sorry. Can I go back? No. Maybe not. Oh, thank you. Sorry. I just wanted to talk a little bit about this, the process of this. So, Orosure were used, and the prison healthcare provider changed to POC testing for hepatitis C, HIV, and hepatitis B. Now, we have done years and years. I mean, our prison peer program's been running since 2017. So we've done years and years of high-intensity test and treat events, outreach. We've had such a massive presence, like in the prisons, and we've definitely reduced stigma around hepatitis C. But there is stigma around HIV, and we had to be very careful, and once they moved over to POC testing for all three, this programme had to come to an end. However, in the future, I would hope that it could be something that could be re-looked at and maybe embedded, because it really does make sense. I just want to give a quick, I'm so confused over my time. Have I talked for more than 20 minutes? I am so sorry. I am nearly finished. And here's me thinking, 20 minutes, I'll never be able to talk that. Okay, really quickly, we do have a programme up and running in a prison called HMP Stoke Heath. It's a non-remand site. It's a Category C prisons, people in for longer, and the prisoners are testing their fellow prisoners and using DBST, so there's no risk of confidentiality being broken. Okay. Sorry, I'm going to fly. So take-home messages: trust, build relationships with the system and people in prison. For us, the system was the trickier one. It wasn't even the people in prison. So optimise people with lived experience. Test, maximise the opportunity to address health needs while in prison, so optimise people with lived experience. Treat, continuity of care from prison to community. Optimise people with lived experience. Thank you, everyone.